Being able to provide a cultural experience that's different to what dentistry has looked like historically is a big part of why my patients like to come and see me.
Thank you everyone for watching this video. I am here with Dr. Sefa. Thank you for coming on, Sefa.
It's my pleasure.
Good. First question, actually, which is brought about by your smile. It's like one thing I've noticed about you always is that you've got this energy, loads of energy. Where does that come from?
It's a good question. I used to listen to a guy who said that the powerhouse doesn't have energy, it creates energy. And so I wake up in the morning, I get on my spin bike, I do a workout, I read my Bible, I pray, and I get myself into the right frame of mind. If I'm driving to work, I'll listen to a sermon or a podcast. And I like to get myself in the zone so I can bring the best of myself. Because you know yourself, if you walk into a room and everyone's dull and looks really sad, it brings you down. And for me, I want to proactively bring people up. When I walk into a room, I want to give them some of the energy I have. And so I invest in creating the energy in myself before I deal with people in the day.
Brilliant. So it's that morning routine. And is this something that you've done for a long time? Is it something that you've always you realized when you were younger? And is this a different side of you as well than when you were younger or anything like that?
I think my morning routine has changed a lot. So this week I've done 55 straight weeks of Peloton, which I'm very proud of. You can't see, but just below the camera is my spin bike. It's not a Peloton, I call it my fake-a-ton. I didn't want to buy an actual Peloton until I knew I loved it, but I actually love this bike. So at the moment, my morning routine is wake up, fitness, shower, breakfast, a sermon, or I read my Bible, and then after that point, I get into whatever it is. But that routine has changed. It's been different things at different times. And there was definitely a large period of time where it most definitely did not involve working out at all. I would sit in bed and read, but I think morning routines are really important. And I think I've changed them over the years to suit what I need most. So part of it is recognizing what I need for myself in this season. So maybe in a year's time, I'll be doing something a little bit different. But yesterday, I woke up, before I went to sleep on Sunday night, I realized that I'd left my work bag at work, and I work at 2 practices. They are about 50 minutes drive from each other. So I had to wake up early to go to my one workplace to get my work bag and then head to the other workplace. And because of that, I didn't have my morning routine. And I felt it all, I just felt slow and tired and lethargic, and bringing the energy and the joy was a lot harder than it normally is. So this morning, I was very happy to get back on my bike.
Do it again. And I could see how that would relate to the work that you do, because obviously you work with patients day in, day out. And how have you found, how do you think that affects your patients as well, when you walk in, you're full of energy, full of enthusiasm?
I think looking after yourself is pivotal to being a good clinician. And I'm not going to put a label on what that looks like. For me, it's prayer, fitness, eating well. I think being able to bring my best self. One of my patients said to me last week that coming to see me in surgery is not like coming to the dentist. It's like a party or a rave. You've got the music going. And I think especially for patients who are anxious, they're anxious about seeing a new person, we've got all of our PPE. I think being able to provide a cultural experience that's different to what dentistry has looked like historically is a big part of why my patients like to come and see me, because it doesn't feel like a clinical situation. And so then I bring that into my consultations. I care about my patients' mental health. I want to signpost them to services. I want to have those kinds of conversations. And if part of being at my peak self, I said, if I've got a patient who's come in and they are carrying something really heavy, it means I've got the capacity to carve space for that conversation. And I think bringing that allows me to look after their holistic health overall, which for me doing my holistic stuff helps me to provide that, albeit in a very limited way, for my patients. So I think it's absolutely pivotal to how I do my daily work.
Yeah, this doesn't sound like something you learned in dental school, is it?
No.
Yeah, so is this just been your own, like, just personal development, things that you do outside and things that you gather and learn and that sort of thing?
Yeah. I mean, the idea of a morning devotional in religious circles is something that's as old as the hills. It's always something that you've been encouraged to do. So that's something I've always done. But then I've listened to speakers like Brendan Burchard, who talks a lot about routines and patterns. So I've got a diary, I write things out in my desk diary, and I have a methodical way of doing things and putting some of that structure in. I guess I have borrowed from a couple of different people. And Brendan is somebody who I listened to for a long time. If you've never listened to him, do go and listen to some of his podcasts, The Charged Life. It used to be called The Charged Life. I can't remember what it's called now. But listening to those people and listening to the practices and the routines, the habits of highly effective people, kind of putting those blocks in place and saying, like, right, these are my immovable things, and then fitting everything else around it has been really helpful. So yeah, reading, for want of I don't want to say self-help, but listening to motivational speakers and people who have got skills that they didn't get doing dentistry, and also listening to some dentists. So today I've been putting together templates and automated responses. Like, there are lots of different ways to put structure around what you do. And I think it's up to each person to figure out what that looks like for them, what balance of things work.
And I guess all of this is evident, like, from what you're saying, what your patients say, and also what we see on social media, what we see you doing, and you coming on and your content, and that kind of we can see that side of you. And I can't imagine many patients sit there and think their dentist does this kind of stuff. I can't imagine that. Do you know what I mean? Which is great, because it's different, it's new, there's energy and that sort of thing. When going to dentistry, is it something that you always saw yourself doing?
No. I thought that I was going to be a performing artist. So before, that probably also feeds into a lot of what I do. But before dentistry, I taught musical theatre, so I do music, singing, and dance. And so I think a lot of my confidence came from that. And my mum and my dad told me that if I went into performing arts, I would die hungry. Like good African parents, they told me that was not a valid career choice.
Yeah.
I then thought I was going to do law, but my mum said that I was too emotional. And in hindsight, she's probably right, because I would just get too stuck into the cases. And then I really wanted to be a clinical psychologist. And my parents were not a fan of that idea. They said that it was probably worth thinking about psychiatry. Again, classic African parent advice. And so I decided to do medicine unless I could think of something better. Then I met a dentist who didn't work evenings, weekends, on calls, or have a bleep. And both my parents are doctors, and so they did all of those things. And I thought, that's better. Same kind of scientific, artistic license, minus the unsociable hours. And so I made an intellectual decision about dentistry. I'm definitely not one of those people who was dreaming about being a dentist. And I don't think I fell in love with dentistry until my second year of dental school.
And now, being an actual dentist, has it lived up to what you expected?
Yeah, so I never expected to love dentistry. I just expected it to be a job, but now I love what I do. Like, I love my job. I love being able to create safe environments for people and to change their life through their teeth. I would never have foreseen that would happen, but I couldn't imagine myself doing anything else in the world.
And have you got a favorite area of dentistry, or is there something in particular that
So I am currently finishing off my master's in King's in fixed and removal prosthodontics. So I love being given a bomb site and recreating it, like putting things back to normal. So I love composite bonding. I love my veneers, but I really like my complex smile design cases. So if anybody does follow me on Instagram, you'll recently see a case where I had composite bonding, whitening, crown lengthening, dentures, and porcelain veneers all in one case.
Wow.
For me, that is what I love to do. And when I look at those before and afters, my patient and I were sat the other day just thinking like, wow, it is, for me, it's such a dramatic transformation, but using lots of different treatment modalities. That's my favorite place to be, because you have to plan and you have to think, and you have to think carefully and be flexible enough to change the direction of treatment as you go along to get those kind of.
Okay. And I always speak to dentists about things like, having their ideal patient and having an understanding of their ideal patient and that sort of thing. And there you just described a case, the kind of cases that you like to work on. And now just thinking about it on the other way, what kind of people would you say normally have those kind of problems? Would you say just rough?
So a lot of those patients are now actually tending to be much, much older, and I kind of prefer it. I love seeing the easy and straightforward cases, and a lot of the younger patients have that. But some people have had years and years of dentistry, and they've had bad experiences with dental services. They've had big fillings, teeth taken out, things not explained to them. And so, yeah, they're in their 40s, 50s, 60s. I've got a few who are in their 70s and 80s. They've got disposable income and they've decided to invest it in themselves. They might be planning to retire, or they might have a daughter or a grandchild getting married, but they're in towards that kind of like middle to older end of the age bracket. And in my mind, they're highly motivated patients. They're people who maybe in the younger years didn't pay as much attention as they could. They've had kind of piecemeal bits of dentistry, a little bit of this here, a little bit of that there. And they've woken up and said, no, like we need to get this sorted, and I want to do it comprehensively.
Okay.
Yeah. That's my like little
that's your area. And what kind of things do you do to kind of like cater for this kind of group of people?
I'm not sure I do anything particularly different. I just sit and chat and explain things. I think for a lot of them who have had old school dentistry and maybe haven't engaged for years and years and years, or who have NHS dentistry and they've never inquired about what is available privately, they've never had the opportunity to sit and discuss their hopes, their dreams, their desires, and then be involved in that conversation as to, okay, this is where we are, this is where we get to, here are all the options, let's move the Lego pieces around and figure out what's going to be the best part for you. And I think that move from where your clinician is the authoritative person who is telling you this is what you're having and this is what you're doing, I think creating space for those kinds of conversations with those patients, because a lot of them are very trusting. They still have that mentality of the doctor's always right. And I'm like, well, no, actually, it's your mouth and it's your smile. I want you to be involved in that process. So I think creating space to have those conversations is really helpful for those people. And then I book for my face-to-face consultations. I'm meeting a lot of people on Zoom, so doing a 30-minute Zoom consultation so that they can have a conversation with me face-to-face, and then a 45-minute in-surgery consultation. And then I send them a big old report about everything they could possibly ever want to know. And so I think the way that I put my services together in that way kind of hits the things that they want to know, because they don't want Groundhog Day. They don't want what they had before. And it gives them a lot of opportunity to feed into the process, give their thoughts, opinions, ask their questions.
Brilliant. And you almost read my mind in the way you answered that question, because my next question was going to be, how do you think dentistry has changed? Because I see a lot of differences in what we used to see as, even the way we used to think about our dentists, just like, you describe yourself, and a lot has changed. What do you think are some of the main things that, dentistry have changed, or even how dentists present themselves, how they deliver their offering?
So I think there are a couple of big changes. I think technologically and in terms of innovation, dentistry has come on in leaps and bounds in terms of the actual things that we can provide to patients. So that even since I've graduated, the difference has been huge. So you have the treatment we can provide, how much patients know about it. Patients are a lot more clued up than they used to be. And there's definitely been, I think, a power shift in that interaction between clinician and patient, um, which I think can be a good thing and can be a dangerous thing. I think the authoritative dentist who tells you this is what you need and this is what you're having, come back next week. I think it's a good thing that we're seeing less and less and less of that. But we've definitely seen a shift towards the patients having more power in those interactions, which I think is great. But obviously patients aren't dentists, and sometimes it makes those conversations a lot harder than they need to be. And I think that there's definitely been the rise of the celebrity dentist. I mean, we have dentists on magazine covers, we have them on the news, and that was again something that I wasn't particularly aware of when I graduated. It didn't really exist. And I remember a point maybe 2-3 years ago where I thought like, oh, actually, how I turn up to work and how I look and how well put together I appear, whether I am on the inside or not, is actually really important. My public persona is more important than I think it used to be when I first graduated.
Mm.
So turning up not looking like I fell off the back of a dumpster truck. Of course, the dentistry I'm going to provide is the same, but I think patients pick up a lot more on the things that happen around the dentistry. They're a lot more customer service driven. And I think that's perhaps where that power shifts, that sometimes patients are shifting more into customers, and that it's a tricky balance to find the balance between those two things. But patients want a nice snazzy practice with a dentist who's got a perfect Instagram page and gorgeous before and afters. The criteria for being marked as a good dentist by patients, I mean, it depends on how good your feed is on Instagram. Unless you're in my ideal age category, in which case you got referred by your friend, so it's fine.
And obviously one thing that we talked about obviously before even starting to record, we started talking about the dentists of Instagram. So tell me, what are some of your thoughts about the dentists of Instagram?
So yeah, I told you I have a love-hate relationship with this. So disclaimer, all of my friends who are dentists of Instagram, I actually absolutely love all the work that everybody's doing, but I think it creates a particular challenge. Because I was explaining to you earlier how I've had patients who've come in and said, well, I've had this work done, but I expected it to look like this. And they're showing me work of somebody else's Instagram page, which is fine. But maybe you need to see that clinician. And if you want that outcome, I think we have so much power in what we put out, but I don't think patients recognize that for the majority of us, we put up the top 10, 15, maybe 20% of our work. And in some ways, rightfully so, you want to show the best that you can do. If your Instagram page is your shop front, you don't want to put like your old creaky cases up there. But I think it's created an environment where patients do think that all dentistry is like that, all dentistry looks like that, and it can create a false expectation. And patients will see like, well, so-and-so has had this and so-and-so has had that. So I've had patients who've come in and say to me, I need whitening, 6 composite veneers, no. And they've given me their shopping list, which is basically off the post of Instagram of somebody else's treatment that they had. And I'm looking at them thinking like, you're not suitable for half of those treatments, and you don't need the other half to get to where you want to go to. So I think that on a patient side of things, it is challenging. I have in some ways tried to conscientiously in my own self counteract that by I don't always put up cases that are perfect. I will put up cases that are less than perfect, but still have a good result. Because I remember that actually the people who, my pages to my patients, I want them to see what's available, actually what other dentists think about my work is less of a concern to me. They're not my target audience. And I want my patients to know that actually this is how I work. This is how my work works in my hands. And I want them to know that, and I want them to see that and be aware of that. But then the other side of things is, and I had such anxiety during lockdown last year when I was kind of revamping my Instagram page, because I was comparing my work to everybody else's work. I'm like, well, so-and-so has these great photos and this, and they're doing this, that, and the other. And before you knew it, I was just like, I'm just not going to post. I'm going to wait a year. And when I have perfect cases, I'm going to post them. And I had to take myself to a corner and give myself a pep talk that, well, actually, Sefa, you are a good dentist and your patients do love your work and you are providing treatments that people don't know about and they would like to know more about. And so I've almost had to mentally take myself out of the dentist of Instagram competition. Although I'm sure people look at my page and probably go, oh, there goes another one of those dentists of Instagram. But that's not how I see myself.
Yeah.
I don't see myself that way. And especially with mentors for dentists, I have a huddle and we've got a community of people who are recently graduated and right at the beginning of their career. And I hear their anxiety about sharing any of their work and sharing their cases. We see less so on Instagram, more so on Facebook. Sometimes someone will share a question or a photo and there's like professional takedown, and you just think, oh gosh, for our young colleagues who are coming into the profession, it's really hard. It's really, I mean, I've been doing it for a number of years, but I find it hard. But imagine being a recently graduated FD who's set up their Instagram page and putting up their shop front, and they are up against the dentists of Instagram, quote unquote. But they don't necessarily know from the get-go that even those dentists are only putting up the best of the best cases. Nobody's putting up all of their cases. And I think it would be lovely if as a profession we could do something to debunk some of that, but I don't know what that looks like. The way I get around it is that in surgery, I sometimes have a photo book. And so I will show patients on my physical photo book, and then when I do virtual consultations, I've got a digital one, and it looks like my Instagram page, but not all of those cases are on my Instagram. And I will try and find somebody who looks most like that patient and said, okay, I saw this patient and they were similar to you in this way. This was the outcome I was able to achieve with this patient who started off at a position that was similar to you, which is different to somebody like scrolling through their phone and being like, I like this look, please recreate it. I'm like, I'm not Top Shot. I can't just like farm it out like that. So yeah, I think that we've got to do something in educating our patients about what our Instagram pages are, and also like advising and having those honest conversations off Instagram with our other colleagues and our younger colleagues about what it is we're posting, why we're posting, and what our actual clinical work day to day looks like, what things we find hard, easy, challenging. I think that there's got to be, with the whole dentist of Instagram thing, there's got to be scope for those kinds of conversations in addition. Otherwise, we're all chasing this top 10% that, granted, if you're the dentist who hits that every single time, brilliant. I'm still on my way to being that consistently predictable. And yeah, I think it can create a lot of pressure and a lot of stress.
Yeah, because and you're like you hear it a lot. You know, you see people who they post pictures and they look absolutely amazing, and half the time it's also the thing that you get people who might not be able to afford to pay 15 grand or 20 grand worth of treatment. You know, whereas they've put this picture and says, oh, we transformed this person's smile, you can have that too. You know, and then they probably come to you and say, I want that. You know, but then you say to them, well, to get that, you would need to pay such and such, and they just think, oh, you come in with crazy prices. So I guess because people are not sometimes putting out the full truth of this person had everything that we offer, you know, and this person paid £20,000 to get this smile. It wasn't just, you know, Invisalign alone, and now, you know, they look absolutely amazing. And even in marketing, I suffer the same thing, in the sense that you get a lot of marketers out there who promise people the world, say to, you know, I'll get you all of this, I'll get you that, this, that, and the other. And just like, I just decided I'm not just going to take part in it at all. For me, my most important thing is the client happy with the result that they've got? What did they
Exactly.
want? You know, you wanted to get this many more patients, you wanted to get this, have we achieved that? Are you happy? Yes. Okay, great. You know, instead of going down the whole, I'm going to get you this million, this and all of that. And yeah, you could get lost in the minefield of, you know, all of these different things that people are offering out there. And, you know,
State of mind, right? Because you do have to have that conversation with yourself. Because
mm,
in in my mind, I consciously think of me, myself, my brand, my page as not part of the competition.
mm,
I've opted out, but
mm.
obviously it's not out because like I don't have a little disclaimer saying that just PS, I'm not competing with anybody. But that state of mind that I'm not, I'm not competing. Like this is not a competition that I am taking part of. I think you do you do have to make peace with that
Mm,
and take yourself to the side and give yourself a pep talk
mm,
and make that decision that you're just going to bring and be your authentic self, whatever that is at the
mm.
moment.
Yeah, no, certainly. And I think patients appreciate that more, because your focus is not trying to impress other dentists. Your focus is on the patient. What does the patient need? You know, what do I need to offer them? How much is it going to cost? You know, and all of these different things, instead of looking at, you know, what's this person and all of these other people doing. And one of the things that you talked about, I'm just weary of time now. One of the things that you talk about, we talked about early on, is collaborating. That's something that you said you're doing more of now. Tell us a bit about that. As a dentist, how does that benefit you in any way, shape, form?
So I collaborate in two ways. I collaborate with other clinicians who are based within my practice and outside my practice. So shared care. So I will refer somebody out for a particular type of procedure, which I think a colleague is better at providing. And we will basically work on a case together. I'm working more and more with my therapist, chatting about cases to free up chair time so that I'm doing the work that I'm most capable of doing. And she's using her skill set as well. But the type of collaboration that I'm absolutely loving is a lot of the stuff we're doing with Mentors for Dentists,
Mm,
meeting and learning with other dentists in an interactive space. And I know there are lots of platforms that do that. We're by no means the only one, but I've I've learned a ton from a lot of the people who've come on and spoken to me, and then subsequently had conversations with people said like, well, actually, I've got this case coming in, like what are your thoughts, what would your advice be? And sometimes it's just somebody who's got a slightly different experience to you casting their eye over something and they spot something that you didn't see because you've never seen it before, and the moment they point it out to you, you're like, oh, how did I not see that? And then you'll see it again and again and again and again. So like I went on a training course with Govinda Birth and we were looking at polishing composites. And I said to him, like, I always find that I have this problem. And he said, like, if you look at the tooth this way and you adjust this part, that will disappear. And I remember looking at my mirror being like, how have I never seen that
mm,
before? So
mm,
sharing tips and tricks. Matt Parsons is a great one for this. He shares tips and tricks on his Instagram, and he's probably my favorite dentist of
mm.
Instagram. But
Yeah.
we've got a group chat that I'm in with Matt, and one of our other mentors shared a case and said, I'm planning this case. What do you think? And we all had a big long conversation over WhatsApp as to what we thought the best way to address something was. And I think actually that's brilliant. You're
Mm,
learning and collaborating with clinicians who aren't in your surgery, but you're benefiting from their knowledge and expertise, and then your patient benefits from
mm,
that.
mm,
So I think collaborating is really powerful, and we should do more of it, thinking more of bigger teams. And your team isn't limited to the people in your surgery or even in your practice or even in your city.
mm.
You can collaborate with people, I don't know, anywhere. Pick a place, any.
Yeah, brilliant. And just before we end, one of the things obviously that you've done well, even on social media, is I believe you created a nice page and people are able to come on and you have various different things going on. So tell us, what are some of the things that, you know, you let's say someone that's new to social media and that sort of thing, what are some of the things that, you know, they could be doing, you know, to get themselves a bit more out there?
So I think be yourself and introduce your patients to who you are. If I could give anybody one piece of advice, it would be that especially if you're at the beginning of your career, because your patients buy into you as a person. Obviously, they want to see what you can do. But the other thing is, check yourself out of the competition. You are not in competition with other dentists. If somebody calls and says, I want to have this done, and so down the road says it's gonna, okay. There are lots of people are saying, but there are more than enough patients to go around, and there will be patients who will benefit from your limited skills, and they will grow with you, and they will become your biggest fans. They will tell everybody about you. So yeah, on my page, I've got like a little bit of a pattern. So I will share something about myself. I will share before and afters. I will share reviews from patients, and then I will share knowledge about particular treatments, what it actually involves, what it actually looks like, because I want my patients to have good information. So if you come and you've got 2 teeth and you say, I want veneers, I'm like, I'm sorry, you don't understand how veneers work. And so I think of my page as a place to inform and educate, and introduce. Inform my patients as to this is what's possible, educate them as to what's involved, and introduce them to myself. They are the 3 things that I try and do via my page. But have a look around, look at the dentists of Instagram, look at how people are doing their pages, make a list of the pages that you like the most, and then look at how they're formatting their posts, look at what content they're posting, what pattern they're using on their grid, write down the things that you like, and then decide what's going to work for you. Because I spent lots of time scoping out other people's pages and then came up with something completely different.
Okay. And one of the things you talked about is education. So how do you educate? Because one of the things that I've seen a lot of dentists fall into is they use very technical language when trying to educate their patients on different things. So how do you educate without just confusing your patients completely, because they're not a dentist?
Yeah, I'm sure some of my patients are still most definitely confused. I try and use like models and pictures or diagrams, or use like something to relate it to. So I once heard a friend of mine describe veneers as like having false nails. I was like, that's a brilliant way to, because if you didn't have a nail, you wouldn't have anything to stick it to. So I picked up things from different people using analogies, so like describing gum disease as a post being in the ground that's lost all the mud around it, and so it's flailing around in the wind. So I will try and use analogies to describe things. But you've probably seen on some of my IGTV, sometimes I get like a really good model or something comes in and I'm like, oh, this is really good to talk about. And so I'll jump on live and be like, this is what I'm talking about. But I think it is tricky. I do some of it in surgery, that especially when you're trying to describe something to somebody, being able to, I call it a trial smile, being able to show somebody something on their own teeth so that they would understand how it works, I think is a really powerful tool.
Okay. And final question. Final question just left my head. Right, okay, yes, it's back. Right. So what are some of your aspirations and dreams when it comes to dentistry then?
So I would love to work and collaborate with a team who are all in-house. That would be my dream, to be able to never do an endo again because we've got an endodontist and a microscope in the room next door, knowing that they're actually going to provide better outcomes than I possibly could because of their education and their setup. So I would love to be the prosthodontic lead at a practice, working together with other clinicians who are also at varying levels in their career to provide the best care for our patients. That would be my dream. But we're getting there. slowly
And that
making.
would be my next last question. what kind of things are you doing to kind of also just get closer to that dream where you want to get to?
So part of it is thinking about what I put up on my social media. So talking about treatments that I would like to do and showing patients photos of things that I would like to do is a big one. Making sure that the physical nuts and bolts of my working day and my working week actually complement me and give me the time to do the work I want to do. So like I was finding that I didn't always have enough time to see my private patients, and then they were being booked quite far ahead. So now we're like, okay, we have private blocks, NHS blocks, and kind of blocking out my day so I can take the time to do the work that I love, and making sure that the people who are working in my practice understand the kind of work that I do. And then obviously Instagram is like my portfolio. If I was to ever apply for a job and someone said, what could you do? I'd just be like, scroll. Like, this is my top 10% of my work, have a look. So I photograph everything. And even recently looking at cases, looking back and reflecting on what I used to do, how I used to do it, and seeing how I have grown. I've got those to show a potential employer, well, hey, actually, this is where I started. This is where I am now. And I'm not done yet. So like, follow the trajectory where we're still getting better.
Brilliant. And third final question. Promise,
This is
it's
like
final
we'll call
question.
it a quick fire round. We'll call it a quick fire round.
Yeah, final question. So I know you do some work with other dentists. So if you just tell me a bit about the work that you're doing with other dentists, and also where can people find you?
So I run a platform with my friend Christian called Mentors for Dentists. We support and educate recently graduated, well, our target audience is recently graduated dentists. We actually have dentists from all across the experience spectrum. And so I collaborate with lots of other dentists and dentist platforms through that. I also collaborate with other dentists in Liverpool. The one that I work with the most is a guy called Peter George. He is amazing. He does some of my more surgical work, and if we're doing implants, and I work alongside him as well. And then in my practice, I work at Northway, I work at Orchard, and I've got amazing therapists at both practices who also support the work that I do and make sure my patients brush their teeth. You cannot underestimate the power of having a good therapist and getting patients stable. They're much better motivators than I am. So yeah, they're the places that I collaborate with most often.
Okay. Where can
And
we
people can
find
find
you?
me you can find me anywhere. Facebook, Instagram, my website, all Dr. S Ahiaku. It's this, if you put Dr. S Ahiaku into Google, everything will come up. I have finally managed to tie it all together in a nice little pretty bow. But yeah, Facebook, Instagram, my website. If people want to do virtual consultations, you can find that by my social media as well. You can jump on and we can have a chat.
Brilliant. Brilliant. No, thank you very much, Sefa. It's been absolutely amazing. Hopefully we can do it again soon.
Yeah, I would love to. And thank you for inviting me onto your page to chat to people. It's a real privilege.
Brilliant.